Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia, and it is coming up to 3 o'clock in the afternoon. And surprise, surprise, my guest today is Dr. Ed Zuckerberg, who normally lives in California, but he's actually today in Florida, which means that it is 3 plus 8 is 11. It's coming up to 11 o'clock at night in Florida, and he's as bright as a bunny and ready to go and talk with us about a whole pile of dental stuff. Ed, thanks for being up so late, and this is your normal time of getting work done. So welcome to the Ultimate Dental Podcast. Thank you.
Oh, my pleasure, David. And yes, this is my prime work hours, even during my work career, where my dental office was in my house. We would try and stop work about 5 o'clock and go up and have dinner with the family. Then afterwards, some one-on-one time with the children, or maybe go out to dinner with my wife, tuck my wife into bed about 11 o'clock at night, and then head downstairs to the office to deal with any paperwork, notes, anything I had to do. It's nice and quiet. The phone doesn't ring, and there's very few emails coming in. And back when I was working, of course, there was even no such thing as emails. But it was always a nice, quiet time. No kids coming in to disturb, and it was prime working time for me. And of course, having my office in the house meant I didn't have to get up that early to commute to work, because my commute was about 25 feet down the stairs.
Lovely. Very, very convenient. Interestingly, I learned in my first associateship from the owner of the practice that you didn't have to live close to your practice. He lived in an upmarket part of Sydney where he sent his children to school, and he worked in a working class part of Sydney where he made his income. And so the distance apart was, almost that Sydney was in different phone jurisdiction. It was like almost an intrastate phone call. It was that different. But Ed, you and I met, I think, in 2017 at a dental speakers conference. So we've known each other for a while. You've been down here to Australia, and
Yep.
you and I have enjoyed a very fine dinner with our wives. So it's not like I've come knocking on the door to talk to you today. It's nice to reconnect, and we did reconnect a couple of years ago, or it may have only been last year or the year before, in terms of something that we're going to talk about today. And we'll get to that because it is a subject that is really important to you and to me, and should be important to all dentists, and that's oral cancer screening and oral cancer detection. But you mentioned about your practice in New York, and your practice was in your house. And we were speaking before we started the recording about how you became a dentist. You and I have a very similar situation in that we are not the children of dentists, and nor do we have children that are dentists. So we're kind of, it was just a situational thing at our time that it was expected that smart people should become medical people. Is that the story with you? Is that how it was?
Pretty much. I mean, I did take a test. I remember when I was in high school, where they throw some, of all different disciplines at you, and then they see what you did really well in. And there were also some like spatial things, where they show you a cube that's open, where you can see all six sides of an open cube. And then they tell you when the cube is assembled, what's opposite the star. And so in your mind, you have to assemble that cube and imagine how it looked. And somehow from that, they could tell whether you had spatial abilities. And I remember after taking that test, it came back, said I did really well in the sciences. My score report indicated that I was good with spatial, which meant I'd be good with my hands, and that I liked helping people. So I had like 3 or 4 things that it came up that it spewed out as being recommended to me, and one of them was a dentist. And I had never thought about being a dentist. I had very few experiences in the dental chair to even know what a what a dentist did. I mean, I had one cavity my whole life. And kind of my mother had a lot of problems. And whenever she went to the dentist, I got dragged along. And occasionally the dentist would say, hey, Eddie, your turn. Come sit in the chair, and he'd go look at me and clean my teeth and whatnot. But I really never developed a feel, or said to myself, I like what that guy does. I want to do that when I grow up. I didn't do it. That didn't happen. It was kind of, and when I walked into dental school at NYU, at the College of Dentistry in downtown Manhattan, and I guess it was September or August of 1975, and there were 200 of us starting in that class. I later found out about 100 had parents who were dentists. So they were kind of moving in to, the family profession, so to speak. But I remember hearing some classmates talking about a bridge, and I didn't know if they were talking about the Brooklyn Bridge or the Manhattan Bridge or what bridge they were talking about, or no less that a dental bridge even existed. So I was pretty green.
Yeah, you remind me. I remember in first year, the question was asked in class, "Do you use floss?" And I remember turning to the guy that I'd friended in that week and said, "What's floss?" He said, "I think it's that stringy thing." And so, but I'd been dragged along to the dentist, and I think I had 2 cavities at that stage, or two restorations at that stage, being 18. But never had I been introduced to dental floss by my dentist. And my mother kept changing us from, if you didn't like the dentist, you'd just change us to another dentist. So we saw about 4 different offices during my childhood. But yes, same sort of story, that I was expected to be smart enough to be a doctor and missed the mark. And I said I was going to go back to school and do my certificate again. And she said, well, why did you put dentistry as a second choice if you didn't want to do it? So I said, good call, Mum. Let's give it a go and see what it was like. And here I am today. So very, very similar stories there. Ed, how did you set up your practice? Why did you set up a practice in your own home?
I had an experience right before I started dental school that really made an impact on me. I had knee surgery done from an American football injury to my knee, and after the operation, we had to go back and see the doctor a couple of weeks later to get the stitches out of my knee. And the doctor said, well, don't come to my office, I'm going to have you come to my office in my house. So, okay. So we drove to his house and we let ourselves in the side door. It was still dark. The door was open. We saw his name, so we knew we were in the right place. And we were like sitting there for a few minutes, and then he came down with a bib in his neck, and he had some tomato sauce coming out of the corner of his lip. He was still eating dinner. And he said, "I'm just finishing dinner. I'll be right down." And he came down a few minutes later and took out my stitches, in his home office that he used to small procedures that saved him a trip to the hospital. He obviously wasn't operating on anyone's knees in his house. But years later, I was thinking, if you want to really achieve a nice balance between work and family, as dentists, we work long hours, and the day is not done when we're finished with patients. There's paperwork, insurance forms, dictation, bill pay, stuff like that. You might never see your kids. And so I thought that it would be a really cool way to have a nice balance of life, to have an office in the house. And there were, at the time, there were at least 3 or 4 dentists in the neighborhood where we were looking to buy a house who had dental practices in their home. And I thought, well, a house is going to be pretty expensive to buy, but if there's a practice that comes with the house, we'll be able to, earn some income, and that'll offset the cost of the house. So it was a win-win. It worked out 100% for me. I would recommend it for anyone that's, I know some people that they like that half-hour or 45-minute drive to the office, or the drive home to clear their head before, greeting the family and stuff like that. One guy told me he only lived 5 minutes away from his office, and he needed some transition time, which I didn't. But he used to pull his car into the garage and then shut the car off and take out the newspaper. And he would sit and read the newspaper for a half hour before going in to greet his family. Everybody's different, right? What works for me might not work for someone else. And people said, you're going to have people ringing your doorbell on Sunday and, calls at all hours, and didn't happen. People were very respectful of the fact that, we worked hard, we had long hours, and true emergencies do happen. And if they do, you can't get any more convenient than just having to go downstairs to deal with the emergency.
Especially when you don't have to wait around for them to turn up because you've got something to do in your own home.
Yeah. And if a patient cancels, I got a million things I can tinker with either in the office or in the house during that time.
You raise an interesting point. If somebody says that they enjoy the commute as a way of relaxing from dentistry for when they get home, and because sitting in traffic to me is not a way of relaxing.
No way. Hate that.
And Manhattan traffic's just as bad as it's up there with it's in the top 5 in the world, I would say, in terms of.
Well, we lived in Westchester County, and my first office that I had before we bought the house was in Brooklyn. And Brooklyn is a southern borough. And my wife, we got married about 6 months after I completed my 1-year dental residency program. And she was on a gap year between college and medical school. And the agreement was wherever she went to medical school, we'd go, if it might have been another state. Turned out it was only Westchester County, about an hour north of Brooklyn. So we initially rented an apartment for a couple of years. And I was commuting about an hour each way to my office in Brooklyn. And at one point I said, I really like Westchester. Having grown up, both of us in the city, which was very hustle and bustle, Westchester was close enough to the city so that if you wanted to go see a Broadway show, you could be there in 30, 40 minutes, but much quieter, more relaxed, laid back, less traffic, nice place to raise kids. You could get a house with a yard, which you're not going to have in the city. And I said, let's buy a house, and maybe we can buy a house from a dentist who's retiring, and I could start transitioning from working in Brooklyn to working in Westchester in the house. So that was the plan, and we executed it.
Well done. And you were in that practice in your house for how many years?
32, from like 1981 to 2013.
All right. And then from there you moved to...
Yeah. Howard Ferran, the founder of Dental Town. So, funny story. It was the summer of 2010, and Facebook was still kind of a new thing. They had just rolled out pages for businesses in 2008, and most dentists did not have Facebook pages. Howard did, and I did. We were, both early adopters. And Howard called my office one day. He and I did not know each other. And my receptionist, who was pretty good about screening calls from salesmen and stuff like that, she said, there's a guy by the name of Howard Ferran, and he said you will take his call. So I was between patients, and I said, he's right. I will. I'll talk to Howard Ferran. And Howard goes, Ed, you're a dentist. And I said, Howard, I've heard you were really smart, but you just clinched it for me, It turns out, he said, Ed, I'm trying to become friends with every dentist in the world, and your son won't let me have any more friends. I've got 5,000 friends already, and I can't have any more. And I said, well, Howard, it sounds like you set up your presence as a personal profile when it should be a business page. Go look at that time, the president was Obama. Go look at Barack Obama. He's got 4 million people following him on Facebook. So you need to change that from a profile to a page. And he goes, well, how do I do that? Can you help me? So I helped him, and he was thrilled. And he says, Ed, you need to write an article for the next month's edition of Dental Town right now. Does my office need a Facebook page? So I wrote the article. It was pretty well received. And they came back to me and said, you need to write more. People loved your article. What else do you want to talk to dentists about? And I said, well, I'm not, I'm a really good dentist, but I'm not going to teach them in an article how to do a crown or something like that. But I've had an interesting journey with technology. And I can write an article, which I did, about my journey with technology, how I evaluate technology, which technologies I adopted early. I was like one of the first dentists to use digital radiography in 1998. I had the first IBM PC XT with a dental practice management software in my office in 1985. And I had adopted intraoral cameras in my office in the late 80s. And actually, funny story, because the guy who made the first intraoral camera, the AccuCam, which he ultimately sold to Dentsply, just last year, he pitched an ultrasonic periodontal probe to me. So 40 years later, we've come full circle. And the same guy who sold me my first intraoral camera is now trying to pitch something else to me. So after the articles that I wrote for Dentaltown in 2010, I started getting inundated with phone calls from people with dental startups. Hey, can you advise us on how to get this product to market? Or local dental societies were asking me to lecture to their alumni association or their constituents. Dentists want to know how do they build a Facebook page? How do they integrate technology in their practices? And around the same time, in 2011, by that time, we already had 3 of our 4 children living in Palo Alto, California. We had Mark, who started Facebook, our oldest daughter, Randy, who had been running the marketing for Facebook for 6 years, and our youngest daughter, Ariel, who graduated Claremont McKenna, which is a small liberal arts college in Southern California, and got a job working for a startup in Palo Alto. And the only of our 4 children still living on the East Coast was my middle daughter, Donna, who was finishing up her PhD in Princeton in classics. So despite having 3 kids in California, we're still living in Dobbs Ferry, Westchester County, working away. And the changing event was the birth of the first grandchild. So our grandson was born in May of 2011. He's 13 and a half now, almost 14. And we got the news that Saturday afternoon, just as we were finishing up patients at 2 o'clock in the afternoon, that my daughter's water broke. We got a Delta flight at 7 o'clock out of New York to San Francisco. We landed at 10:30 at night with the time change. And around midnight, we were there holding our new grandchild. Oh, wow. And my wife looks at me and says, "I'm staying. Are you coming?" So I said, "Well, yeah, I'm where you are, but we have a house and a dental practice in New York, So it took a couple of years to transition, to find a buyer who turned out to be one of my previous associates, who actually wanted my life. He bought the house and the practice from us and took everything over. That was in 2013. And by that time, I'd been doing lecturing and advising startups during the time I was spending like 2 weeks in New York, 2 weeks in California. And when I was in California, I wasn't doing dentistry. So I was focusing on my new budding consulting career. That's when I would really spend time with the companies I was advising. I would schedule some lectures to dental societies, study clubs, things of that nature. And, from the summer of 2013 on, we've been living full-time in California and focused almost totally on advising startups, still doing some lecturing, working as a venture partner for Revere Partners, Revere is the first independent venture capital firm that only invests in early and pre-seed dental or oral healthcare startups. So we look at lots of new companies and decide, what our investors should invest in. And that's really cool, looking at being able to really sift through all this budding new technology. And we can only invest in a few, and they all need help. And there's lots of them with great ideas. And I wind up, joining many of them as an advisor, even if we don't invest in them, and help bring them to market. So it's a fun second career, so to speak.
It's lovely that you have found this great second career and that you get enjoyment from it. I know a friend of mine who was a dentist and then was a coach, and he's now in his third career as a grandparent, which he really likes as
We
well.
we just had our. He's a year old now. We just had our 10th grandchild.
Oh my goodness.
So we have the oldest who's 13 and a half, but we have 10 between our 4 kids. And the youngest is, that was her first, so there'll be more. And for me, at this point in my career, I am just all in on the oral systemic connection. And I need to find, and I'm still struggling with finding work, life, family, fun balance. This is supposed to be the golden years, to enjoy, but the work I'm doing in dentistry is just so important with, oral cancer and the correlation between oral bacteria like P. gingivalis and systemic diseases like dementia, heart disease, diabetes, arthritis, digestive cancers, such, that I see our profession really exploding into a big change where dentistry is essentially we can't stop it. It's just a question of how soon we're going to get there, where dentistry is going to be the new primary care for patients. Physicians don't look in patients' mouth. My wife, who's a physician, is the first to tell me that in medical school there was zero training. The only reason they ask a patient to open their mouth is to stick a tongue depressor on their tongue and tell them to say ah, so they start in the throat. They don't look at the tongue, they don't look in the floor of the mouth, they don't look in the cheeks, they don't look at the teeth or the gums, they don't do anything with the mouth. And for years, dentistry was this walled off profession. Well, those guys are carpenters. They fix your teeth when they break, but the real doctors are the ones that put a stethoscope on your chest. And the reality is now that we understand that bacteria like P. gingivalis, that is the keystone pathogen of periodontal disease, that's present in elevated levels in 50% of the population over age 30 and over 80% of the population over age 60. And P. gingivalis is spewing toxic proteins which make their way into the bloodstream in patients with high levels of PG in the mouth. And those toxic proteins in the bloodstream are the drivers of inflammation, which cause most of the maladies that affect systemic health issues in mankind. So the real way to really affect change in people's lives going forward starts with a healthy mouth. And people are getting this message. They're getting the message now. They can't pick up a magazine or a newspaper without reading an article that says, hey, healthy mouth, healthy brain. There's a correlation. You don't take care of your mouth, you have gum disease, you're at higher risk for dementia, higher risk for heart disease, higher risk for diabetes. And people are finally, for years, they've been saying nay to dentists who are saying, we need to work on your gums are not healthy. And they didn't see the importance. They didn't believe us. Somehow we let people get away with thinking that their gums bleeding when they brush or floss is normal. That's a bad thing, and we are to blame for that. If their eyes or ears were bleeding, they'd be at the physician's office yesterday. But bleeding gums, that's no big deal, right? Well, it is a big deal. And people are starting to get the message.
Well, it is important to educate the public that, that the infection that's in their gums, in their blood, in their mouth, is the same blood that then pumps through their healthy heart and their healthy lungs and their supposedly healthy brain as well. So you were the one who alerted me to P. gingivalis when I did the Viome test a couple of years ago. And lo and behold, you were working as and you still are, the chief dental officer for Viome, and they had a test. They still have a test for oral cancer screening, and I came across this oral cancer screening purely by accident and filled in a questionnaire which Viome was suggesting that dentists send their patients when they're coming for, as a text message, when they're coming for their hygiene visit. Do you have these? Are you predisposed to? Did you smoke? Yes, sadly I did. Worst decision of my life. Only for 6 years. Haven't smoked for 40 years. But tick. Do you drink alcohol? Yes, I do. Three nights of the weekend, I'll have a glass of red wine, or maybe a couple. So there's 2 ticks straight away. So I did
You and I can spend a lot of time talking about wine.
we could, but the thing with that test was that for me to get the test, I had to get Viome to send it to a dentist in Oregon. He then mailed it across to Australia to me. I then had to mail it back. Then they lost it. It was lost in that office. Finally, they got it. Finally, it got to you, and I'm expecting this just to be a test for oral cancer. We talked for an hour about P. gingivalis and all these.
Well, that's the amazing part. The amazing part about, Viome's test is like, to me, the number one game changer in dentistry today, because it checks all the boxes. When I did my residency at the Brooklyn VA hospital in 1978, after I graduated dental school, I and the other residents and the staff at the Brooklyn VA were put in charge with developing the head and neck cancer examination protocol for the entire federal dental service. That meant the Army, the Air Force, the Navy, all the Veterans Administration hospitals, any federal agency. And probably my biggest disappointment in my profession in the 46 years now that I've been a licensed dentist, my biggest disappointment is that the 5-year survival rate from oral cancer was 50% when I graduated dental school in 1978, and it's 50% today in 2025. Yes, there are some amazing rehabilitation therapies that we can do for people after we remove their jaw from cancer. We can take a section of their leg bone, we can put dental implants in it, and we can implant that section of leg bone into the jaw and give them, something they can chew on. But we're not saving lives at any greater frequency. And the reason is that we have not developed anything to help us find oral cancer early. By the time a patient has a lump in their mouth that the dentist sees, or a red mark or a white mark, or they go for a biopsy, by the time it's diagnosed, it's a pretty late stage disease. Chances are it's already spread rapidly into the lymph nodes in the neck. The surgery almost always is debilitating and disfiguring, and involves a radical neck dissection of the lymph nodes of the neck, and the hope that they've stopped this disease before it has metastasized elsewhere in the body. What Viome has is they use a series of biomarkers that test using mRNA expression of organisms and pathways that are going on in the saliva, that through algorithms, through AI and machine learning, they've learned to reproduce from patients who have cancer what the salivary reporting looks like in someone who has cancer. So now we can give the patient a score which can basically say at this point, with a 95% degree of certainty that we can pinpoint from a simple saliva, all the patient's doing is spitting in a tube and sending it to us for testing. With a 95% reliability, we can say whether that patient has squamous cell cancer of the mouth or throat. Okay, so we're also pulling in, pathogens and toxins and carcinogens and things that are tripping our biomarker test from the throat, things that dentists can't even see even with a normal dental examination. So what this means is we now have the capability to find patients who are either at the earliest possible stages of oral cancer, or maybe even are in the developing stage of oral cancer but haven't developed it yet. And we can flag these patients and follow them, meticulously, find lesions at their earliest possible stage. And when we do that, we're going to be doing much more conservative surgical removals, and we're going to be saving more people from disfiguring surgeries, and we're going to be saving more people from metastatic cancer that's going to kill them. So now all we need is implementation to get dentists to do this on every patient. To screen them. It's not an expensive test. The cost should be around $200. Why wouldn't you do this on every new patient? And then based on risks, do they drink alcohol? Do they smoke? Are they elderly? Do they have a family history of someone who had oral cancer? Things that would flag them. Do they have positive HPV, human papillomavirus? Do they have things which we know put them at higher risk for oral cancer? If they do, well, then we want to test those patients annually, whereas other patients maybe every 5 years, like a routine colonoscopy, just as a screening tool. But if we implement this test, we're going to find more and more early oral cancers, and we're going to save lives and prolong lives. But Viome's, if Viome's salivary test, which is called Oral Health Pro with Cancer Detect, if Viome's salivary test only tested for oral cancer, it would still be amazing. But it does so much more, which is a reason why it should be done annually. For one thing, it uses mRNA technology to examine the bacteria and what the bacteria are expressing, not just DNA. There are a number of salivary diagnostic tests out there on the market. Companies like Bristle, Oral DNA, one company went under this year, Direct Diagnostics. Too bad, I really like them. What those companies do, though, is they're just spewing reports from the saliva of all the different bacteria that you've got in your mouth. And there are pages and pages of bacteria, and we know there's really only 3 to 5 that matter, with P. gingivalis being in the lead. F. nucleatum, denticolor, Tannerella falciparum, those are the real bad boys of periodontal disease. And with P. gingivalis, as you know, P. gingivalis is an incredibly highly evolved pathogenic bacteria in the mouth. It is evolved to the point where it avoids detection from the human immune system. So we don't start any immune response reaction to it at all, and there's no antibiotic at all that we can use to treat it. So as dentists, we're left with the tool to scrape it off, scrape the plaque and tartar off, remove the colonies of bacteria that are on the teeth and under the gum line. And with it, we're temporarily lowering the load of P. gingivalis in our patients' mouths for like 3 weeks. 3 weeks. So even if the best patients come in like 4 times a year, they come in every 3 months, we're buying them 12 weeks a year of lowered bacterial count in their mouth. The other 40 weeks a year, they've got full load bacteria. And what we know that's really scary about P. gingivalis is how it works by, it creates these gingipains or toxic proteins. So the bacteria lives in the gums. It's very happy living in our gums. It's a great environment for it. It hates oxygen. Deep in the pocket under the gum, there's not much oxygen there. But the toxic proteins that it spews are designed to create an environment. Acidic gum tissues, inflamed gum tissues, that environment favors P. gingivalis to continue thriving. The collateral damage to our bodies is that the gingipains, those toxic proteins, because of the leaky gums and the inflammation in our gums that causes our tiny local blood vessels to dilate, those toxic proteins or gingipains get into the main bloodstream. And one of the greatest mysteries has been Alzheimer's disease for a long time, right?
Yes.
How do we stop it? How do we stop it? And what causes it? We know that in people with Alzheimer's disease, there's greater quantities of beta amyloid plaque in the brain. And most of the drugs that are given to Alzheimer's patients now are designed to break up and minimize those beta amyloid plaque. I mean, beta amyloid plaque in the brain in large quantities is kind of like us finding a late stage cancer. Those patients are too far gone. They're not going to get their mentation and reverse their dementia. And we know that the greatest single evolutionary protective mechanism that mammals have evolved is the blood-brain barrier, right? The blood-brain barrier essentially seals our bloodstream from our cerebrospinal fluid. So it keeps our brain and our spinal cord and nervous system sterile, even in the presence of bacteria circulating in the bloodstream. We've only had one bacteria that we know to date that can actually cross the blood-brain barrier. That's meningococcus. And that's why you can die in like 2 days from meningitis, because a meningococcal infection in the blood can get into the brain and kill you very quickly. P. gingivalis doesn't really enter the blood in large quantities. And even if it did, it couldn't get into the brain. It couldn't cross the blood-brain barrier. But its toxic proteins do. The toxic proteins of P. gingivalis can penetrate that blood-brain barrier. And they go into the brain and they interfere with neuronal transmission. And that's your dementia. And now the body does attempt to combat the toxic proteins of P. gingivalis in the brain by engulfing them with T cells and macrophages. And the byproduct of that immune response to the toxic proteins of P. gingivalis in the brain is the formation of beta amyloid plaque. So we understand the whole process now. And if you can shut P. gingivalis down at the gum level and prevent the gingipains getting into the bloodstream, you're not going to have a barrage of toxic proteins entering your brain. That equates to less dementia going forward. And similarly, heart disease, diabetes, and all these other diseases are started by the inflammatory process of the gingipains of P. gingivalis getting into the bloodstream. Now, here's the kicker where Viome's salivary detection test differentiates from everyone else. DNA during life doesn't change. Your DNA when you're born is the same as your DNA during your life and the same as your DNA in your body when you die. What changes is mRNA. mRNA actually is what causes certain genes to express themselves. So you might have the DNA that predisposes you to a certain type of cancer. But from looking at someone's DNA, you can't tell if they have that cancer. From looking at mRNA, you can. Likewise, P. gingivalis can be in the mouth without spewing toxic proteins or gingipains into the bloodstream. And a generic salivary diagnostic, like many of the other companies offer, all they're doing is measuring quantities of bacteria and their DNA. Where Viome differentiates is Viome is measuring mRNA. mRNA, which not only does Viome, in other words, not only can Viome tell from your salivary sample that you have high levels of P. gingivalis, but through measuring the mRNA expression of the individual organisms of P. gingivalis, Viome can tell whether you're actively spewing toxic proteins of P. gingivalis. So the periodontal health score that you get from the Viome test, in addition to the oral cancer screen score, is a measure of, what is your state? What is your periodontal state? We're measuring not only just bacteria, but how active the pathogenic bacteria that are in your saliva are.
Ed, is that something that is influenced by hereditary as well, or is it just purely environmental? Is it the levels of P. gingivalis and the toxins that are emitted? Is it something that your DNA, you're fighting your own DNA in terms of the amount, or is it just something from neglect that all of a sudden you've created?
Well, the microbiome in the mouth, which is, like the microbiome in the gut, there's, 4 main orifices in the human body that have their own unique microbiome. You have the mouth, the gut, which is connected to the anal opening, and then in women, the vaginal cavity also have their own unique microbiome that is affected by pH, acids, what's in there. And our mouth, obviously, the microbiome is affected by what we eat, and how well we take care professionally. If we go to the dentist regularly, we have a healthier microbiome. If we brush and floss and remove the plaque, we have a healthier microbiome. If we eat a lot of sugar, we're favoring the growth of bacteria that are unhealthy. That's bad for our microbiome. So in the mouth, eventually adults have a very complicated microbiome in their mouth. They have some good bacteria and they have some bad bacteria. And you can have P. gingivalis in your mouth in a very small quantity. As we know, through kissing and sharing food and sharing glasses or whatnot, we share each other's oral microbiome. Eventually one day we will, like now we have a vaccine that's been around for a while, Gardasil, for HPV, for human papillomavirus. Okay, our children are not exposed to human papillomavirus until they become sexually active after puberty. If we can vaccinate them with Gardasil against HPV before they become sexually active, they're not going to be infected with HPV during their lifetime. Similarly, there are companies working on a vaccine to administer to adolescents against P. gingivalis. That would mean that P. gingivalis would never take a foothold in their mouth. But, one of the, we have a lot of tools that we're developing now, which is what makes my job so fascinating. So for example, one of the things Viome does after they test your saliva is they will actually develop formulations customized for your oral microbiome to improve the health, to increase the competitive balance in favor of good, healthy bacteria and make it harder for the pathogenic bacteria like P. gingivalis to survive. They do that with customized probiotics, prebiotics, and postbiotics, which are delivered to the patients in the form of lozenges and toothpaste. Custom-made lozenges, custom-made toothpaste, only available to patients who've gone through the Viome oral salivary test. So, that's one way we're helping. Another way is, I recently joined the team at Oral BioLife as their chief education officer. And, and my role is to educate fellow professionals about the work they're doing. And they have a gel which up until this point has only been used in dogs. It's placed subgingivally using a blunt irrigation needle into the gingival crevice, much like you would administer Arestin, a minocycline, subgingivally, but it's fluid. It's like a liquid, but it's light curable, so it'll stay under the gum tissues for a period of weeks. And as we know, when we chew, our teeth move, right? The teeth are not in concrete, right? The ligaments that connect our teeth to the supporting bones allow for a certain amount of give. So when we chew, some people grind their teeth, just clenching their teeth together, there's movement in our teeth. That movement against Oral BioLife's proprietary Amberlux gel causes the gel to release piezoelectric energy. It transfers piezoelectric energy that lyses the cell membranes of the pathogenic bacteria living subgingivally.
Fantastic.
And in canines, in dogs, not the canine teeth, in dogs, we've actually demonstrated that we've regrown bone in the furcations of dogs' molars that had horizontal and vertical bone loss with furcation involvements. We've regrown bone in that furcation after scaling and root planing and applying the Amberlux gel into the dog's gum pockets. So it's pretty cool stuff that's out there now. A couple of other companies I'm working with, one has a custom tray that is like a slightly rubberized version of a clear aligner that you would use to straighten your teeth. And the tray has channels inside the tray. So you have this custom fitted tray with channels with openings right at each embrasure. Each embrasure, each interproximal area between each tooth is an opening in the tray. And the trays are disposable. They come preloaded with a bactericidal gel. So the patient, after they have their teeth cleaned, they get prescribed trays to wear for 30 days at night. And while they're either sleeping or maybe wear them for an hour while they're listening to the David Moffet podcast or whatever. While they've got this tray in, they're medicating intimately into their subgingival tissues through the interproximal papilla through these custom fitted trays that are made from a scan of their mouth. So great stuff out there being developed that we're helping get to market, and I think it's a really exciting time. We understand the role of dentistry, and I'm envisioning a date, in the future, in my crystal ball, where 10 years from now, someone goes to a physician and say, "Hey, doc, I have a problem with my blood sugar. I need some medicine for diabetes." And the physician says, "Well, before we do anything, the first step is you need to see our oral health care specialist, because before I can treat you for any diseases in the body, most of them have origin in the mouth, and you need to start with the oral health care specialist and get their blessing that your oral health is in tip-top shape. Once they do that, then we'll focus on anything else that's wrong in the body." So the role of the dentist will shift to one as a primary healthcare provider.
Well, I hope that happens, Ed, because it is much needed. I had somebody working on my renovation a couple of years ago. They told me of somebody they knew who needed to have an operation, and the doctor said, "You need to get your mouth sorted out." They went off to the dentist. They were left with 3 teeth left after they cleaned their mouth of all the rotten teeth and the gums, and that was just to have a general anaesthetic. So there's a lot of pathology in somebody who is obviously suffering no pain. What about if that's somebody who had such a grossly disturbed mouth from a dental perspective? What about the naivety of the public out there who don't really know what's going on in their mouth, and all of a sudden now we're revealing this is really affecting...
I mean, we know the traditional barriers to dental care. They're fear, money, time, right? Nobody has enough time to take care of themselves. They sooner take care of their children and their dogs and cats before they take care of themselves. They're fearful of painful treatment. So that's another reason to say no. And quality dental care is expensive. Yet another reason to say no. So these are traditional barriers, but when it becomes common knowledge that this is the single most essential thing you can do for your overall optimal body health is to have a healthy mouth, we're going to get more adoption. And as we get more adoption, the role of dentists change, people are going to be healthier. We as far as costs go, we need to get, this is a whole separate issue that I could spend another hour with you on. We need to get medical insurance providers paying for these tests, for the Viome screen test. Dental carriers won't pay for the test. I mean, medical carriers are the ones that stand to gain the most. If someone comes down with oral cancer, that person is going to cost the medical insurer over $1 million in their lifetime, with all the complicated care and reconstruction and illness that they're getting, hospitalizations they're going to have. Plus, if we treat more patients with periodontal disease and get more people healthier, insurers are going to have less heart disease to pay for treatments for heart disease, less dementia. I can't tell you how expensive it is to treat patients with dementia, kidney disease. Medical costs are crazy for these insurers, and we're painting a pathway for them to really, by paying for this screen test, help us identify people, get us to treat them earlier, and just generally have a healthier population.
We definitely need that, Ed. And I know down here I heard a statistic that more than 50% of the Australian federal budget for health is spent on keeping people alive in their last 6 months. And that's a lot of money spent at the end when the end is already decided. And so if we can extend that and use that money in prevention, I'm excited from what you've said today about the connection with Alzheimer's. My father has had Alzheimer's and dementia since for 11 years now. Still lives.
Yeah, and I think I told you my mother passed away from Alzheimer's 21 years ago.
It's a horrid condition. He's very candid about it. He's not an angry Alzheimer's patient at all. He's very candid about it, but he's my mother has already passed from 20 years ago from a ovarian cancer. So my sister now has this sentence of being his primary carer, of looking after him for the last 11 years. And, she's with him every other day, and he has other care funded. It's not fun. So if we can shorten the journey of Alzheimer's and find it before it happens, I think that's a good thing. And if we can find that and other connections in what's going on in here to what's going on in the rest of the body, I think, as you said, dentistry is not about panel beating and carpentry, really. It's about overall health. It should be the window to the rest of the body, as opposed to that little corner of the body that doctors don't really take any interest in at all.
Absolutely.
Ed, we've run out of time tonight, but I'm really looking forward to the next time we talk, because this is the never-ending story, isn't it? The ability to develop and work with companies in this exciting field of being able to have tests on markers of things that were just predicted as being, well, that's your lot. You've got to live with it. Now we can actually determine the future if we can get in early enough. Ed, I appreciate your time tonight. How do people get in touch with you if they want to find out more?
So they can email me directly at drz, Dr. Z, at painlessdrz.com. They can visit my website, which is painlessdrz.com, and they can message me directly from the website. Or if they're on Facebook, they can go to Painless Social Media, and they can message me there.
Too easy. Ed, it's been a pleasure talking with you. Thanks so much. Lovely to reconnect, and I look forward to talking to you again. Thanks very much tonight. It is almost midnight where you are. Thanks for being a guest on.
Yeah, I only have about another hour and a half of work to do, so
you're a
I'm
champion.
still hitting my stride.
Yeah, thanks for being a guest.
Next time we'll talk about wine.
Sounds good. Sounds like a plan. Appreciate your time tonight. Thanks, Ed. Thanks so much.
Okay. Good night.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes, packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.